facing surge in Lassa fever cases with 209 infections and 53 deaths recorded in just 4 weeks since the beginning of 2025, resulting in a fatality rate of 18.3%. The deadly viral disease transmitted through contact with infected rodents or contaminated items remains a major public health concern. In response, traders have implemented preventive measures, including placing chemicals at strategic points in their stores to deter rats and prevent contamination. Details in the report.
Awali Issa is a trader at the Kotako Grains Market in Jos. He says they have devised measures to keep rodents away from contaminating them, which contributes to Lassa fever infections.
There are chemicals we drop at strategic points in our stores that are harmful to rats, and then we also bring in cats here. So by these measures, we are able to address the issue of rats eating our grains and contaminating them with their droppings.
Lassa fever is caused by the Lassa virus and is usually transmitted to humans through consumption of rodents and food contaminated by their droppings such as urine and feces. Nigeria's Center for Disease Control (NCDC) says the confirmed cases are across 10 states of the Federation out of over 800 suspected cases.
In preparation for the farming season, people will clear farmlands by use of fire. You know, when you set a farmland on fire or bush on fire, of course, the rat will have to find somewhere to go. So the poor sanitary conditions, poor environmental care makes the rats, have a place where they can groom their young ones and then multiply.
According to the NCDC, more than 8,000 suspected cases of the disease were recorded between January and October last year, with more than 100 deaths recorded. Health experts say the government needs to improve on measures to tackle the disease and its spread.
People need to know that, okay, yes, there is this disease that is around, and these are some of the symptoms. And when you see it, what do you do next? So health education is also important. And as I mentioned earlier, treatment. Our health facilities should be equipped to treat cases of Lassa fever.
The government says it is taking steps and has activated a management system to coordinate response to the situation. The country's Minister of Health, Ali Pate, has also formed a team that is engaged in conducting research for a vaccine for the virus. Last month, he convened a meeting to assess progress on the situation, but there's no categorical pronouncement on when it will be ready. And so for now, people like Awalu who are in the business of preserving and selling grains will continue to devise ways to keep rats away and keep their foodstuff from being contaminated.